Well, we're informed by using a framework that we're probably all familiar with. It was developed initially for helping patients regarding smoking cessation and adapted a little bit later for other substances of misuse like alcohol. And it's called the 5 A's. We've adopted the 5 A's to apply it to obesity and changed the first A to ask. Ask permission to discuss your patient's body weight and their preferred term. The way I typically say it is this a good time to talk about your weight? Because you really need to have an open, transparent, non-judgmental conversation with the patient. And by asking permission, you're being inquisitive, you're showing interest in the patient, and it's up to them in order to accept your invitation. Now, many of you would ask, well, I don't ask permission to talk about hypertension. Why should I ask permission about obesity? That is because obesity is unlike almost any other condition, or at least it's similar to other conditions that are sensitive and subject to bias and stigma and discrimination. Patients are feeling that, and they have a legacy of feeling that when they work with other healthcare providers. So asking permission is very helpful. And then you can go on and frame your encounter with assess, advise, agree, assist, and arrange according to how you normally see a patient. So I mentioned this a little bit on the last slide, and I just want to come back to it to make sure everyone really understands what the definitions are of weight bias and stigma. This is probably one of the last areas in medicine that we still have to conquer. I think the whole idea of stigmatizing someone for depression or stigmatizing someone for alcohol misuse or narcotic use really doesn't exist very often, because we understand those are diseases of addiction or mental health issues that are worthy of our attention and treatment. That's not necessarily so for obesity, though, because we have our own biases that we bring to the table as we think about people who struggle with their weight. And I just want to read out loud the three definitions that you should be aware of. One is weight bias, which is negative attitudes towards a person because of their weight. It has to get back to that person first language, obese patient. There's probably, you harbor these internal attitudes. Second is weight stigma. And those are stereotypes and labels assigned to people who have obesity. If you see someone who's overweight in a cafeteria, often we'll say, well, why are they having a hamburger? Look how overweight they are, right? You stereotype them like they should be eating healthier, even though they get hungry and we eat hamburgers as well. We really shouldn't blame them for something like that. And the last is weight discrimination. Actions taken against people who have obesity that can cause exclusion or inequalities. The whole literature is full of individuals who suffer from obesity, who have lower income, marriage rates are different, income rates are different, socialization is different, all because of these three biases and stigma and discrimination.